Hi, there's my brother's coming. Hello, Hank.
Hi.
Oh, I want to go back to having the background that was the MCOE. Yes. Oh,
Yeah.
Nikki's running the show from behind. Hank, so first off, some people don't know why we're here because they just are seeing a Vlogbrothers Live notification and they're confused and they maybe haven't seen a Vlogbrothers video in 10 years, in which case, hello. Thanks for dropping by.
I can't believe I didn't think to have champagne.
Oh, I did. I had, yeah.
Dang it.
So we are celebrating the groundbreaking of the Maternal Center of Excellence in Koidu Town in Kono District in Sierra Leone. This is a dramatic expansion of Koidu Government Hospital, and we have supported Partners in Health and the Sierra Leonean Ministry of Health and fundraising for this project. And after a year and a half or 2 years of fundraising, we have finally broken ground. They have finally broken ground. And today we're going to be joined by some of the people who are at the center of that story to talk about the groundbreaking, to talk about the future of a stronger healthcare system in Sierra Leone. But first, we wanted to take a second to say some big thank yous.
Yeah, I mean, so first of all, I wanted to say thank you to John Green. So it was years ago that John said to me something along the lines of, I think that we should have a big multi-year project. And I think that that project should be centered around the idea that there are big problems that are not sudden catastrophes. They are ongoing, but not like moments. And we respond well as humans to moments. But what is happening every day and has been happening every day for the last 20 years just seems like the way that the world is. But the way that the world is can be as catastrophic as a sudden disaster like the tsunami that we as a community responded to, or the Ebola outbreak that the world responded to as a public health crisis. And as has often been the case for our brotherhood, I think that we are both pretty good at believing the other one and going for it. And I just believed you, and I didn't really know what that meant. I didn't really know what it would mean. And but with your leadership, but also more importantly with Partners in Health's leadership, there was opportunity, one of many opportunities, but this opportunity made itself very obvious, very clear, that this was something that could be done. It just had to be something that could be done, and it had like over a long period of time. It couldn't be something that would be done immediately. And also, like, this is the beginning still. And this is something that will be like continue being done 10 years from now. Like, it will not be done 10 years from now because none of this is designed to be done. It is the work of lifetimes. And like, that's how all the good, important stuff gets done. So thank you for getting me involved in that. And thank you for getting our community involved in that.
Yeah, long-term problems demand long-term solutions. And that's one of the main things that I've learned from talking with people who are really making the change in the world. And those long-term solutions, it's easy to get distracted along the road, and there are always challenges and there are always struggles. And but the problems that were created by the long history of impoverishment in Sierra Leone and other impoverished communities, those problems were created over the course of centuries, and the challenges will be the challenges of generations. But the Maternal Center of Excellence is going to be a teaching hospital. It will train the next generation of Sierra Leonean healthcare workers, and it will also. And we're also already seeing the change, which is something I want to emphasize. At Koidu Government Hospital, just in the last year, child mortality has been reduced at the hospital by over 50%, which is an incredible accomplishment, especially given all the challenges of trying to provide clinical services during a pandemic. So we are very grateful to our friends and colleagues in Sierra Leone. We are also so grateful to our community, because it's really the community of people who watch these videos who over the years have helped us to see that truth, that what that we need to be thinking in the long term, and we need to be thinking about generational change. And we need to remain hopeful in the face of big problems. And thousands of you became monthly donors to this project when we first announced it, even though there was no building to get excited about. There was no progress yet to show. And we are so grateful to everybody who became a monthly donor. And of course, we thought that when the pandemic hit, it would be devastating for this project because we assumed that people would pull back. But what happened instead is that more and more of you became monthly donors. More people joined the matching fund to make sure that every one of those monthly donors has their donation matched every month. And as a result of that, we are here today. I do want to thank a few people specifically in the community. This list is too long. There's no way I'll ever be able to thank anybody, but I do want to say a couple of quick thank yous to Susan Wojcicki, the CEO of YouTube, who made a transformative gift in this project, and to the people in the matching fund who, from the very beginning, from the time that I got back from Sierra Leone, were helping me to understand both like how to talk about this challenge and also understanding the scope of it, and that frankly that like more money was going to be needed from us. And I also have to thank my brother, because when I called him and I said I need a lot of money, Hank said, well, let's figure it out. And so we've been able. So if you hadn't said let's figure it out, I don't know what we would have done. Thank you for saying that. And again, thank you to everybody who's donated. If you want to support this project in an ongoing way, you can become a monthly donor at pih.org/HankandJohn. If you want to join the matching fund, if you're in a position to donate to over $2,000, you can either do that directly, or if you have specific questions, you can email me. Although full disclosure, I'm pretty slow at replying.
I have another thank you. I want to thank everybody who works at tftba.com, which is our merchandise company, who works with everybody from Kurzgesagt to the McElroy brothers to us, and over 100 other internet creators. That company donates over 90% of its profit to this right now. And that is a really big part of how we made this happen, and also how we're going to continue ongoing funding. So there's a lot of work that gets done at that company, and those people are working for our customers and our clients, but they're also working for this. And I'm so grateful to them for doing that work. And whether, like everybody who's putting packages, putting things into mailers and mailing them, everybody who's communicating with our clients, everybody who's answering customer support emails, all of that work is a really big part of how this is getting done.
So we're going to welcome some friends from Partners in Health to talk more about the MCOE, show you the story of the groundbreaking, and show you some of what the MCOE is going to look like. But as we do, I also want to say a big personal thank you to Nikki Hua, who works for Complexly and for me as well. And Nikki, when she signed up for this job, I don't think that she knew that she was going to be spearheading a $25 million capital campaign, but she has taken on that task with great gusto and tremendous talent. And I am so grateful. I don't think that we would be here without Nikki. But I mean, the nature of these broad-based collaborations is also that we wouldn't be here without all of us. It really did take all of us. And I also don't want to situate that in the past tense, because as we're going to talk about, this is a huge moment. I think it is worthy of champagne. I do not often drink champagne, but I think it is worthy of it. But there is also still a lot of work to do. And I don't want to lose sight of that. I don't want to lose sight of of what needs to happen next, and the ways that our community can help can help that happen. So that's part of what we'll be talking about with our friends at PIH, who are going to be joining us as soon as they are up. Okay, so just to make some quick introductions, I'm joined in the bottom right, at least on my screen, by Aisha Dumbaya, who is the head of nursing and the maternal lead. Is that right? Am I saying your title right? The maternal health lead at Koidu Government Hospital? You're muted, but I'm sure you're saying, no, it's wrong. It's vastly wrong. And also, but yeah, you're muted, Isita. And also, I'm joined by John Lasher, who has been the executive director at PIH Sierra Leone for the last several years, and has been a hugely important part of this project and the transformation of the healthcare system in Kono. And also by Dr. Byler Berry, who is the incoming executive director of PIH Sierra Leone, and also the founder of the Well Body Alliance, the strongest primary healthcare services in Kono, but I also outside of Kono. So those are my introductions. I don't. Where do we go? Do we go to John and Byler?
I think well, first of all, hi everyone. Hi John. Hi Hank. Hi community. Yeah, I don't know if so we're all in Sierra Leone. Byler and I are in Freetown, the Gap. Isata's in Kono in the Far East. So I don't know, Isata, if your connection's great, but let's give Isata a chance.
I'm good now. I was just trying to find the unmute button and realized I'm what I'm used to.
Yeah.
But yeah, and John, you were close enough. My title changes every day. There seems to be a new letter added onto it. I don't even know what it is half of the time. The latest name I've got is everyone now calls me Mama MCOE. So I'm like, okay, that might work too.
I love that.
Love that.
Just Mama MCOE. That's perfect.
Yeah, make it just say that, and I'm all right with that.
So, Byler and John, I wonder if you can give us some of your perspective on the groundbreaking and everything that led to it, or we could start with that.
Yeah.
How are we all going to start?
Yeah, why don't you introduce yourself, and then I'll introduce the groundbreaking.
Yeah. So I'm Dr. Byler Berry. I'm a Sierra Leonean, born and grew up in Sierra Leone, and went to medical school in Sierra Leone, but then went to Harvard Medical School to do my master's in global health delivery, and also went to UCSF, University of California, San Francisco, to do my PhD in global health sciences. And so I'm currently now the executive director for Partners in Health Sierra Leone, and I'm excited to be here. And I want to thank John and Hank and the community that helped support this project. And I'm very excited to take over the baton from John at this exciting moment, and pushing through the MCOE would be a huge challenge, a huge opportunity for me, and I know I'll be successful because I have Mama MCOE by my side, and I'm sure we'll definitely do a great job. Thank you.
Thanks, Tyler. So I'm John Lasher. I'm the outgoing executive director, but at Partners in Health, we don't really have exit strategies, so we refer to it as Hotel California. So even though I'm not going to be the executive director anymore, I will still be part of this project and will still be helping to support the team in Sierra Leone. So really excited to be here. I want to thank the Green family, in particular, John, Hank, the whole Green family, for your support. And I also want to support everyone who's joined the live stream and has contributed as little as $1 or as much as hundreds of thousands of dollars. This project, which is the single largest health initiative in the country of Sierra Leone, would be impossible without all of the contributions from the Vlogbrothers community, the Nerd Fighters, everyone that John and Hank and their families brought to us through YouTube videos, through their engagement, through writing books, through book talks, Zoom calls, and everything else. Thank you, thank you, thank you to everyone who made this possible. We're just at the beginning. And PIH has been working in Sierra Leone for 7 years since the Ebola outbreak in 2014. And we're not an emergency response organization. We came here to help make sure every single Sierra Leonean has the same access to healthcare that people that look like me have access to in places like New York City. And so that job requires long-term commitments. It requires things that are the opposite of exit strategies. It requires open-ended commitments to be responsive to what ministries of health need. So I'm going to share some slides from the actual groundbreaking, which you all made possible. But before I do that, if you'll allow, I want to grab, it's not champagne, but it's Prosecco. I'm just going to top myself up here. Okay, thank you. And then I'm going to try, cheers, Tyler. Cheers to all of you. All right, let's see if I can do this. It's my first live stream.
We believe in you.
Of your life? Oh,
Yeah, I actually don't know that.
that's
That's
wonderful.
No, it's my first vlog YouTube.
It's your first time in the strange world of StreamYard, but I believe in you.
It's John's very first video call of his life.
What is Zoom? This wild thing called Zoom, or this is something else.
This is
YouTube.
not this is not that.
Thank you to you two, John and Hank, and thank you to YouTube. Okay, I've been waiting. That was canned. Can you all see my screen though? In all seriousness? Okay, excellent. All right. So we're going to talk you through the big event we had to actually break ground on the Maternal Center of Excellence project. This was a huge day for not only Kono District, not only Partners in Health Sierra Leone, and not only Partners in Health globally. This was a huge day for the country of Sierra Leone and the region of West Africa. It is very rare in a country like Sierra Leone to have a health initiative of this size and scope. This is a 166-bed hospital expansion for the only hospital for over 500,000 people in rural Sierra Leone. And I just want to mention that when we first arrived in Sierra Leone as an organization in 2014, this hospital had 150 beds, but it had no patients. It had no electricity, no running water. It had one physician for all of the people, not only in Kono District, but all across Eastern Sierra Leone. And it's hard to believe that just 1 mile away from the entrance of the hospital sits the largest diamond mine in West Africa. More wealth comes out of the ground just a mile away than almost anywhere else in the region of West Africa. And yet their hospital had no electricity, no running water, and the roads weren't paved, and there was one physician. In the entire country of Sierra Leone, of 8 million people, there are less than 500 physicians. In Massachusetts, where PIH has an office, also 8 million people, over 20,000 physicians. So that's just setting a little bit of the context of why this day was so important. Pictured here are a number of Partners in Health Sierra Leone staff members from across the country: Freetown, Kono District, Port Loko, and we have over 530 staff members, and we are going to continue to grow. The Maternal Center of Excellence is going to double our staff easily, if not more than that. And so these are just some of the people that you have all supported to help make the groundbreaking possible, but more importantly, help make the construction and then the eventual operations possible. So the groundbreaking event itself had over 300 people in attendance, many of them from across the nation, including Freetown. Our team organized such an incredible event. Mama and MCOE, Isata Demboya, was responsible for helping to get these beautiful tents. We had a sound system. The event itself was attended by ministers from across the cabinet of the government of Sierra Leone, and it was also attended by this gentleman by the name of Dr. Austin Demby. He's the Honorable Minister of Health for the entire country of Sierra Leone. He woke up at 4 o'clock in the morning to join us at the groundbreaking ceremony. He drove 6 hours to be at a groundbreaking ceremony. And his speech was absolutely inspiring. So this is the senior most health official, and just as background, Honorable Minister Demby was a health administrator in America, a very senior health official at the Centers for Disease Control and PEPFAR, the President's Emergency Plan for AIDS Relief. And he took the call from the President of Sierra Leone to come back to Sierra Leone to lead the health initiative. And he's been doing this for just a handful of months. But this is someone who's aware of Partners in Health. He knows our mission. He also has seen what we've done in places like Haiti and Rwanda. And he used the example of what we've done in Rwanda to really accelerate what he thinks is possible in a place like Sierra Leone. And it was absolutely inspiring to know not only was he championing our program, championing the work of Partners in Health in collaboration with his ministry, but also 2 of his daughters are students at Harvard College. They're students of the founder of Partners in Health, a physician named Dr. Paul Farmer. And not only are his daughters students of Paul's, but also they're working with something called Partners in Health Engage, which is an advocacy group at universities across the United States. And one of his daughters leads PIH Engage at Harvard and actually has been raising money alongside all of you to help make sure that this project actually gets off the ground.
Hey, John, can you push the slides forward?
Yes. Can you see that?
No. We're still looking at the first slide.
Oh, you missed. Okay. Let me try to reshare. Sorry, everyone. Stand by. Too much champagne.
Oh yeah, it's that first 2 sips of Prosecco always does it. But yeah, while John is figuring that out, I do want to say that Partners in Health Engage is a really wonderful organization, and they're a huge part of this story too. They've raised over $100,000 on college campuses for the Maternal Center of Excellence. And so if you go to college and you have a PIH Engage chapter in your school, definitely join it. If you don't have one, PIH.org. Oh, now I see a second slide.
Do you see the Minister of Health speaking into a microphone?
I do, but that's not the slide that's highlighted. The one that I see highlighted is the 350 people listening to the Minister of Health. But it's okay. I think, yeah, it's almost like you have to come in and come out to make it work. I don't know why.
Okay, well, now
it's working. What you just did worked.
Why don't I just do this? Why don't I just move it this way if people can see?
That's great. That's working great.
Yeah.
Oh my gosh. Okay. It's not my first Zoom call, but it is my first time sharing the screen like this. Okay. This is the Minister of Health, Austin Demby, who I was just speaking about. So 2 things from his speech, just jumping back in. He said, first of all, he recognized that in this event for women in Sierra Leone, so many of the officials present were men. And he declared publicly that, he is a feminist, and he was very proud to be a feminist, and proud to be speaking as the senior most official for health in the country as a feminist. And the second thing he said, which was also motivating and inspiring to everyone, was that there was no time for mediocrity in Sierra Leone, that we needed to all move forward to believe that we could accelerate health for all Sierra Leoneans as quickly as possible. And he said this in the shadow of the diamond mine. And I want to just say that very few people ask whether it's sustainable to continue taking diamonds out of the earth for profit, but lots of people ask us whether it's sustainable to think big and aspirationally about making health access a right for all people, including people in rural Sierra Leone. This is the Chief Nursing and Midwifery Officer for the entire country of Sierra Leone. And if Aisata, you want to share a little bit more about Nurse Fula and the importance of nurses, that would be excellent.
Right, so she's Mary Fuller. She's a nurse midwife and a real trooper. Clinically, she's one of the best nurses and midwives I've ever come across. And she is so sold into the MCOE project. She's always there at whatever government engaged meeting that we've called. She's so clued in as to how many staff are you going to need for this? How are we going to do this? And she's thinking about this together. Not as a PIH thing, but as the Ministry of Health and Sanitation, the government of Sierra Leone. How are we going to come alongside you guys and provide the nurses and midwives to make this work? Because she recognizes that in this place, in the Maternal Center of Excellence, nurses and midwives are going to get access to quality education, services, and be able to provide the care that she so longs for. This she trained back in Sierra Leone over 40 years ago, when Sierra Leone's healthcare system worked. And she's had to live through all that total decimation and seeing it be absolutely a shadow of what it should be. And hearing about a project like this excites her, gets her on board, and makes her feel like, yeah, our nurses and midwives are now going to have somewhere where they're going to feel valued and treasured and get access to the resources that they need to improve their skills. So she's a real champion of the Maternal Center of Excellence. Over to you, John.
Thanks, Aisata. So I'm going to see if this will work. This is actually, so after the speeches from the senior health officials and from PIH, including Byler, Aisata, myself, and Dr. Paul Farmer, our founder, we had the actual groundbreaking moment. I was really excited. I had no idea we were going to have a giant bulldozer come and knock down a building on the land. But just to set a little bit of context, the land that we're building the Center of Excellence with the Ministry of Health is actually hospital land that's just next to that existing hospital campus. And nothing had been built there for many years. And then the National Electric Company for the government actually had a power station there to provide energy. But years ago, maybe 5 years ago, that energy station actually moved to another part. So this is largely abandoned space in Koidu town where we're building this. So we had this bulldozer and it knocked down one of the abandoned structures. Let's see if this will work. It was an amazing moment. I don't know if it came through on the live stream, but after that small video was taken, the building to the right also was partially knocked down. So we actually did some work during the groundbreaking. It wasn't just symbolic. And the construction, I know many people are wondering, how long will it take to build this? And we believe that it's going to be between 18 and 24 months to have this built. And the groundbreaking was the very first moment. But we're clearing the land, preparing it for construction, and we have partners across Sierra Leone and across the United States that are going to help make the construction possible. And here is a photo of the actual bricklaying. So in addition to knocking things down, we actually started building some things. And we were joined by lots of different members of the government of Sierra Leone and the Partners in Health team and community members. But I'm just pulling one photo, which is Aisata, Byler, myself, who are on this live call, and Jordan McGinn, who's one of our senior leaders as well in Sierra Leone, has been working here for 4 years. And we're laying the first bricks of what will be the eventual Maternal Center of Excellence. And I'd love, Byler, if you could share a little, maybe some reflections on what this meant to you to be a part of this.
Yeah, it's amazing, honestly, because like, being part of this, being part of like laying the first few blocks and like being a Messina at that moment as a clinician and as a leader at PIH, I was really kind of like proud to be laying this brick and with my colleagues John Lasha and Aisata and Jordan. And like, it's just amazing. Thank you.
Yeah, and Byler, could you maybe like, for people listening, so when you first started working in Kono, could you have ever imagined sort of the state of where Koidu Government Hospital was, where it is today, and where we're hoping to go? And was that easy for you to imagine where things are now and where we're going?
Honestly, I was optimistic that one day, but not as quickly as it happened. But like, I was optimistic that one day we would have a health system that would be proud of and that would care for the poorest people in the country. And like, but like, it's far-fetched. I was thinking about it to be like 30, 40 years down the road, and having partners in health come and support Wellbody and work together to make this happen quickly is just amazing to me. It's just like a dream come true. But like, I had this vision and I dreamt of this, like saying that one day we'll be able to care for pregnant women and because maternal mortality is the highest burden of disease in Sierra Leone. And I was like dreaming of this, but like, it's just a dream. And now that laying this block really makes it real for me and makes it like a dream come true and real, and seeing the reality of it happening. And I think it's like comforting and really makes me happy and proud that this dream is coming true as quickly as I can never imagine. Yeah, thank you.
Thanks, Byler. All right, we had another special guest at the groundbreaking ceremony, and I'm going to hand it over to Isata once again to tell us a little bit about Esther, who's pictured here.
John, the picture hasn't actually changed, but it hasn't changed on my screen. So I don't know if you can pull it. Right, so there we go. So little Esther, she's a 2-year-old. Her mom was 14 when she got pregnant with her. Sadly, this is something that happens a lot in Sierra Leone, and our teenage moms are the ones that they contribute a lot to our maternal mortality. A lot of them do not fare too well during pregnancy and during childbirth. So Esther's mom is called Naomi. So she had her when she was 15. On the back there, if you can see the little dinosaur, so that is Esther's little friend that she has tied up on her back the same way as mothers carry their little babies around. When Naomi was pregnant, she was very, very unwell. So she had a condition called preeclampsia, and she went on to develop eclampsia, which means her blood pressure got so high that she started to have convulsions. And after she had the baby, she lost a lot of blood as well. So she had this baby in our current maternity unit. And the only reason why she's alive today and why this little girl is here and laying bricks for the future Maternal Center of Excellence, it's because the staff at Koidu Government Hospital had the knowledge, the resources, the equipment to fight to save her mom's life. It took several days. Her mom was unconscious for a few days. I mean, she's still, even now, not over that because she's still having to receive ongoing treatment for convulsions. But we did everything we could within that unit and saved Naomi's life and saved Esther's life. So today, this little girl is here. She's well, she's happy. She's showing that she's part of the future generation for the next lot of maternal mortality in Sierra Leone. If we in our current hospital can do and save the lives of little girls like this, how much more once we are empowered and get the Maternal Center of Excellence, a bigger space with more facilities, and more, most importantly, to be able to train our next generation of healthcare professionals in Sierra Leone so that they can be able to deliver the same standard of care as any nurse or midwife in any other part of the world. This is what we're aiming for, and this is what we really want to thank you all for making it possible, so that girls like Esther are here today, being a part of our future, and we're going to carry on making these improvements and making these gains thanks to guides like you. So we appreciate you all out there. Thank you.
Thanks, Isata. And I'm going to close here, and I apologize for anyone who's joined the live stream a little late and are wondering why we're not sharing the full screen. I have some text coming through. I can't see the chat yet, but I'll soon see it. I apologize, it's not full screen. But we tried that and it wasn't moving forward. So I apologize to people who are wondering why we're not in full screen. So I'm going to close on this slide and then turn it back over to John and Hank to lead some Q&A. But I do want to close just by saying that when this photo was taken, when John and Sarah came to Sierra Leone in April of 2019, the groundbreaking ceremony was a distant aspiration for us, even knowing whether or not we'd be able to raise enough money to get to a point where we'd be doing a groundbreaking in 2021. It is so exciting that we're able to uphold the commitment to break ground in April, especially given how difficult the last 14 or 15 or 25 years, I don't remember how long the COVID outbreak has been, but the last year has been incredibly difficult for so many people. And because of your support, and because of support from across the United States, across Europe, and across Sierra Leone, we have been able to uphold the commitment to break ground in April, just as we had planned. You know, I think a lot of people would think about Sierra Leone as a failed state, somewhere where it was very difficult to do big aspirational projects, a place where it's the highest maternal mortality ratio in the world. But the reality is, from 2016 to 2020, the clinic that Byler helped to start, Wellbody and Wellbody Lines, did not register a single maternal death during that 4-year period, in the place on earth with the highest number of maternal deaths. And these are deaths that could be preventable. We call these stupid deaths. Nobody should be dying prematurely in a place like Sierra Leone from causes that haven't been killing people in places like America and Spain and the United Kingdom for over 100 years. And so you all are helping to change not only the narrative, but more importantly, change what's possible for people. And I do want to just close with one more thing. This isn't just a maternal center of excellence. There are many women who will never choose to be pregnant by their choice, or women who can't get pregnant but would like to. This center will also be a center for them. We will focus on adding new and innovative medical treatments for cancer, like cervical cancer, breast cancer, and many other things. This center, as John said at the beginning, will also be a university teaching hospital linked to the National Medical School. We cannot radically reduce maternal mortality without training the next generation of Sierra Leonean doctors, nurses, lab techs, pharmacists, and other health professionals. So with all of that, our work is just getting started. We need all of you to continue standing with us. John, Hank, and the rest of their family have made such a dramatic, open-ended commitment to us and have brought all of you along. And all I can say in closing is thank you all so much. And I apologize once again that this isn't in full screen. All right, back to you guys.
People prefer that it's not in full screen because as they that way. And I think that is correct. I think it seems more authentic. Hank is muted, which is my favorite version of Hank.
I know how to click a button.
Hey, Sarah.
Before we get to the Q&A, and we do have some great questions, and if you want to leave questions in chat, please do. I just want to highlight a couple other things. It is very important to celebrate this moment. This is a huge moment. It was not inevitable. This was not always going to happen. It happened because of the commitment that people in this community and other supporters of PIH had. It happened because of ISADA, and it happened because of John and Byler, and it happened because of the thousands of you who became monthly donors to this project, and because of the support that PIH has put together as well. And so when good things happen, it sometimes feels like they're inevitable. And I want to emphasize that it's not inevitable. But I also want to emphasize that that the reasons that Sierra Leone is so profoundly impoverished and the reasons that the healthcare system is so fragile are also not inevitable. And those also did not happen in any kind of like natural way. They happened because of impoverishment, which is to say that that wealth and historically also human beings were extracted from Sierra Leone in many, and that's very important to understand that there is a historical basis for this. Some of you have heard me say this before, but I think it's really important to acknowledge that. And as Dr. Joya Mukherjee, the Chief Medical Officer of PIH, says in an introduction to global health delivery, the differences in life expectancy and in maternal mortality rates in Sierra Leone are not caused by genetics, biology, or culture. These health inequities are caused by poverty, racism, lack of medical care, and other social forces that influence health. The situation that Sierra Leone is in now is a result of historical circumstances. It's the result of actions that individuals in power took, and it's really important to understand that because if we're going to unwind that, we have to reckon seriously and honestly with our history. I do have some great questions that have come from the community, and the first one is from M. Zealous. It's for ISADA, who says, "How long have you been in the health world, and how did you get involved with PIH?"
Hi. Okay. So I'm a nurse midwife and a public health specialist that trained in England. So I qualified as a nurse in 1995 and as a midwife in 1999. So I've been specializing in midwifery all the way through until 2012, when I then went off and did another course in public health, looking after children aged 0 to 5. So I've been always, and I was born in Sierra Leone, and I came to school, secondary school in Sierra Leone. So I had about a good 6-7 years of school in here, and I've got extended family that lived here. So I've worked in other parts of the world, but when I heard about this opportunity, now Partners in Health in Connaught District, which is where I was born and where my father is from, okay, who doesn't want to do that? And out of let's go and see what this looks like. So I started in July 2018. The plan was to stay here for a year. My family, my kids are all still back in the UK. I was staying for a year. I'm still here, still going on, and it's fantastic. This journey, when I joined in, I was told about this. This was part of my interview process, and I was a bit skeptical, like, really? And they really think they're going to do this? How are they going to do this? Look at the money this is going to cost. How is this ever going to happen? Let's go along anyway and see. This was me at my most skeptical. A year later, I'm like, wow, these guys are serious. They are going to do this. And then we've got the Green family who are making us know that, yes, you are going to do this because we're going to back you all the way through. And we're going to reach out. Then we're going to let people know about what this dream is. And it's going to happen. So I'm still pinching myself. I mean, Friday was like, well, we're here. We're at this point. We're going to build this place. It's going to happen. And it's amazing. But my UK life in midwifery is nothing as compared to here in Sierra Leone. I mean, one woman dying in all that time that I've been doing midwifery in the UK, and I come to Sierra Leone in my first month, there's 5 women just dead from preventable things, from things that would make you stand there and cry. Now it's, yes, women do still die, but a lot less so. We're fighting this battle and we keep on pushing and moving with this till we're going to make sure that we bring those numbers and figures down to where they're supposed to be, so that when you say one woman dies, it is a phenomenon. It is not something that you think, oh, well, you know, she's one of how many. So we're pushing and moving with this. It's such an exciting and thrilling journey. It's nothing compared to what I used to do before. I'm scared in case they ask me to go back. I don't know how I'm ever going to be able to work back in the UK. But there you go. It's really great. So I hope that answers your question.
The first time I met, I thought it was at Koidu Government Hospital, I think, and Sarah and I were there, and she explained to us that a really important metric in survival rates for emergency C-sections is the decision to incision time, the time between which it becomes clear that an emergency C-section is necessary and when that emergency C-section happens. And in the US, that time is usually 20 minutes or less, or 30 minutes or less. And when Isata arrived at KGH, it was closer to 12 hours. And that just, of course, leads to lots of horrible outcomes. And the work that they've done, even with the existing facilities, to reduce that decision to incision time has saved so many lives of mothers and children. And we know that with the MCOE, it will be much closer or even equal to the kind of decision to incision times that you see in settings with far more resources. So it's incredible what you've already accomplished. I mean, it's just amazing to see, and we are so grateful. But we know that this will be a huge acceleration for it. We also have a question from Austin that I thought would be a good question for John or Byler. What have or will be some of the biggest challenges you expect to face as you build the Maternal Center of Excellence and bring better maternal and child services online?
Yeah, do you want me to start? Okay. Thanks, Austin, for that really great question. I think the challenges ahead are going to be how do we make sure we keep up momentum? How do we make sure we continue to build toward funding pipelines and convincing people that the same type of transformational change that happened in a place like Rwanda, Rwanda after the genocide in 1994 had the lowest life expectancy on earth. And in 25 years, in one generation, they were able to increase life expectancy more quickly than in recorded history. So how can we also, as an organization, help support the Sierra Leone Ministry of Health, and how can we continue to convince people around the world that it's not right that people are dying prematurely, especially in Sierra Leone, where, as John, you mentioned, there's a long arc of historical injustices, from extracting human beings during the slave trade to extracting diamonds, to a colonial administration which lasted decades, to a civil war, which ended very recently. So how do we maintain this momentum that we have right now? And that's a challenge on us as an organization. It's a challenge on everyone who's listening here. How do we make sure we keep our, to use, I think, something you taught me, John, how do we keep our attention focused, which is so precious, on the things that truly matter in the world? And that's, how do you make common cause with someone in rural Sierra Leone? You know, I just want to share one example, and then I'll hand it over to Byler. When Ebola ripped through Sierra Leone, Liberia, and Guinea, people that looked like me in places like Geneva and New York, Atlanta and Paris, they said it's because Sierra Leoneans eat bushmeat, it's because they practice traditional funeral practices, whatever that means, and it's the people, the individuals in Sierra Leone, there's something specific about them that makes it so that Ebola spreads there, but not in Madrid and not in New York or Dallas. And that, we reject that wholeheartedly. As Joya pointed out, there's nothing different about Sierra Leonean culture that makes it so that Ebola spreads. There's nothing about Sierra Leonean culture that makes it so that vaccines against COVID don't reach here and probably won't reach here for years. People want access to public health goods in Sierra Leone, just like they want access to public health goods all around rich countries. And so our challenge before us is continuing to push against that. And with examples like the Maternal Center of Excellence, the work we've done in partnership with the Ministry of Health in Rwanda and in Haiti, et cetera, we can start changing not only the narrative, but also continuing to encourage people to make long-term investments in health systems, not just emergency investments during an earthquake or a hurricane or an Ebola outbreak.
So, to add to John has said most of it, but like, let me just add. To me, my biggest challenge that I'm thinking about, how do we keep saying yes? Okay, because there's a country with a lot of needs and a lot of challenges. Yes, we're doing this. It's a great hospital. It will be a great hospital. It's going to be 166 bed. But the question I ask myself, is that enough for the country? How can we continue growing this program? And I think that is a question that I'm battling with, and I'm always thinking about how can we add more services to this maternal center of excellence, where services like cancer care to women, and not only like for women with pregnancy or whatever. How can we have a robust laboratory? How can we have robust diagnostics and care of things that? So that for me is a huge challenge. And what does that require is a commitment that you made and other people with you made, like continuing to support, like not like doing this one time, like. We be used to Sierra Leone, as I showed you, John, when we went to Kumba, and you see equipment sitting there gathering dust because it's just one time commitment and investment, and they don't care about maintenance or whatever. Then it breaks and nothing happened. So it's like a challenge to me, like how can we continue doing this? How can we continue supporting the Ministry of Health? How can we keep saying yes to what the ministry says and what the community needs in the near future? Is a huge challenge to me, but I think it's a challenge that is surpassable. And because like if we continue our long-term commitments, continue bringing more resources to support those things, I think we can overcome that. Thank you.
Thanks, Bob. One just quick thing, if I can add one thing to that. One of the things that has kept me at Partners in Health for the last 12 years, first in Haiti and now in Sierra Leone, is that as an organization, we don't draw a line in the sand. We don't say we're going to finish working at KGH until the quality is the same as Mass General Hospital in Boston. We say at the same time we're making investments at a place like Koidu Government Hospital, we have to be in the public clinics. We don't just stop. If we had just stopped in Wellbody Clinic, we never would have gotten to KGH, Koidu Government Hospital. We never would have gotten to Combayende, where we're now making investments. And so the pressure on us as an organization to do more, I think, is the exact pressure we need as an organization to say, we shouldn't be satisfied. We shouldn't be satisfied with the level of care that's available now. We should be proud of our successes and celebrate them with this bottle of Prosecco that I opened. But we also should say there's a lot more that we need to do. And I think Byler's point's a good one. In order to surpass that challenge, we definitely need more people, not only to give, but also to really think about international aid and development differently than we have been thinking about it.
Yeah, I think that's such an important point, that we need to, because a lot of people in comments have asked, what can I do if I can't give? And I think one of the big answers is you can pressure your government and your leaders to take more seriously the opportunity to build stronger healthcare systems in other communities, to support impoverished communities as they're trying to build their healthcare systems. One of my favorite memories of my whole life is when I saw, unfortunately on Zoom, but I saw Dr. Barry on Zoom, and we were celebrating having passed this $20 million milestone for the fundraising that meant that we could break ground. And Dr. Barry was like, it's great, it's good, but I don't even want to finish a sentence before we start talking about what's next. And that's exactly right. Like, this can't be the end, because there is still way too much need. We need a stronger primary healthcare system in Kono, because otherwise you lose a huge percentage of patients at that level. You need stronger community health worker services, so you have people making house calls when people need house calls, and understanding that this is a long-term, open-ended commitment to address a long-term problem that is deeply rooted in a long-term series of historical circumstances and choices made by people in power. I think that's really important. So the answer to what can you do is ask your leaders what they're doing, because in the end, like USAID, these big governmental organizations, the big funders, they have so much money. And it's true that we live in a world of limited resources, but as Paul Farmer always says, the resources are less limited than they've ever been. And I just don't accept the idea that we need to live in a world where in impoverished communities, 1 in 20 women die in childbirth. I just don't, we don't need to accept that. And we have ample evidence for the fact that we don't need to accept it. And so let's stop accepting it.
Yeah. I mean, especially in a place where diamonds are coming out of the ground, I think it's easy to ignore historical influences in a lot of places, but not in Kono, not in the face of the diamond mine just outside the hospital that had no electricity, no running water 6 years ago. And so there's a lot people can do money. Not everyone can give money. There are people working in Partners in Health Sierra Leone who can't contribute their meager salary to push forward this movement, but they're working tirelessly every single day in lots of different ways. And so I just want to say a couple of things to that question of what more can people do besides giving money. You don't have to be a doctor or a nurse to be able to contribute to health justice. You can be an engineer, as our infrastructure team has shown us over the course of not just this project, but rehabilitating the psychiatric hospital in Kissy, rehabilitating the TB hospital in Laka, rehabilitating Koidu Government Hospital, building a water system, electrical upgrades, etc. You could be a driver going out into the far reaches of Kono district to make sure you're reaching people, to provide information about how to prevent Ebola and what to do if you get sick with symptoms that look like Ebola. So there's lots of ways you can do. You could be a communicator. In fact, we need lots of people to amplify these messages through their writing, through their videos, just by talking to your families about these issues. That's super important. You know, one thing, humility is a huge part of Partners in Health's work. Checking our own assumptions. I just want to highlight one thing as it relates to COVID in America, because some people do ask the question, but don't we have problems in the United States? And absolutely. And things like COVID-19 were presented to us as the great equalizer. That it doesn't matter if you're born in New York or Indianapolis or Kono, you're just as at risk as everyone else. Well, that's not true. More Black people in America have died from COVID-19 than white people. And I think it's true for COVID-19 in a place like Sierra Leone. The marginalized, the poorest of the poor will be and will bear the brunt of things like COVID-19, Ebola, and maternal death. And so we really need to orient ourselves to check our assumptions about why that reality exists. One thing I read recently in the US press is that there's more vaccine hesitancy among Black Americans than white Americans. But not 2 weeks later, I read an article that said Black people live disproportionately further away from vaccination sites than white Americans. So why does Ebola spread in Sierra Leone? Why did it not spread in America? Why are less African Americans receiving vaccines than white Americans? Is it because of culture, or is it because there's less access to public goods? So I think that's another way, educating ourselves. And you both, John, Green, and Sarah, the three of you, how do you say you three, the trio, the Green Trio with us has helped educate all of us and helped make our really complex work a lot more comprehensible to many more people than we ever could. So those are some other ways you can help.
I want to ask a couple more questions. Isata, this is maybe one for you. Is there any way, it's from Glynis, is there any way you could speak more about the reproductive healthcare and family planning options that will be available in the world of the MCOE and today at KGH?
Okay, so already we're looking at it is not just about maternal and giving birth, right? It's about the woman, her family, the support network around her, how and what can you do to improve their options and chances. So with regards to family planning, if you plan your family, you're more likely to have better outcomes. So for all the women within the area, talking to them and their partners about the different options that are available for family planning, sitting there discussing with them and trying to implement the right option for the right person. The MCOE will also be about screening. Like women, we take it for granted for having something as simple as a pap smear test. This is something that doesn't happen here at all. So if you're not screening women, then you're not going to find out, you're not going to pick up on things early enough, and then you're not going to be able to treat. It's about being able to offer those services to all women, young, old, whoever that comes in for both cervical and breast cancer screening. It's also about having a space for adolescents and young people. I already talked about our young women. A lot of them have a lot of problems and complications in pregnancy. And why is this? It's because nobody is ever out there to even talk to them about sexuality. These are things that you only discover after you've become pregnant. And then by then it's too late. Some of them will then go and try and have an abortion in whatever way and end up sick and dying from complications from that. So it's about having spaces where women, young people, men can come in and talk about healthcare, talk about sexuality, talk about how and what can I do to be the best me that I can and have access to the best level of healthcare services that I can. So within that center, this will cover a whole load of things. Our family planning, hey, short-term, but possibly more long-acting reversible methods so that, people can space their families, still have as many children as you would want to, but at the right time and in a way that enables you to do so safely for your body as well. So these are all the services. It's not just about having babies. It's a whole contingent of healthcare for women, children, as well as men. We encourage them. And for the first time, I've got a space in there, Ask Jim. We need to have a space where dads can come and stand and support their women in childbirth. This never happens here. So bringing the men in as well. And whilst they're there, this is the best time to talk about what are your health needs? And when did you last have a screening? When were you last checked for anything? So come on in, everybody.
That's great.
Yeah.
And I want to highlight the opening of the adolescent care clinic at Koidu Government Hospital in the last year as another example of the progress that's already being made, even as we await the completion of the MCOE. Last question from Bill. What is the next health priority in Sierra Leone or in West Africa more generally? When you think about the future in 5 or 10 years, where are we placing our emphasis?
So if my thought is like, I don't consider a disease as the health priority. Is the whole health system is what I think about, because like if you think about just one disease, okay, the next priority is HIV or TB or whatever, you're missing a lot of things. So it's like, how can we build a health system that can like respond to all the sort of conditions in a more effective way? Like, how can you build a community health worker program to be able to serve people in the community and link them to the primary health care? Well, you need a stronger primary health care that could serve these patients. And then how can you build a proper secondary healthcare or tertiary healthcare system where primary care can like refer patients that they cannot care about? So it's the whole continuum of care. I'm thinking about like, how do you build a community healthcare workers, not like to focus on one condition, but like to do a household model where a community health worker takes care of the whole home and like see like what is affecting them, what's like the social determinants or the social issues that deter them from going to the facility. How would you build a healthcare system that is robust enough to care for patients when they're sent there, to like give them the right diagnosis and treat them what they can? And how do they refer patients to the secondary facility like at KGH? How would you build a KGH that can diagnose patients very well and treat them very well and like do all the things that are required, that they can, services that they can have if they're in America or in the UK or elsewhere. So it's like, for me, that's how I look at it. It's not like looking at it as a disease condition, looking at the whole system. How can we build a system that are interconnected? Community, primary care and secondary care is how I think about it, not like thinking about the primary, like the next disease condition.
I think that's a great place to end, because we started this project 2 years ago talking about the importance of healthcare systems and how we often don't think systematically when it comes to healthcare interventions. And that has resulted in lots of these sort of vertical interventions that haven't strengthened healthcare systems in the long term. And this is an attempt to take a different way, to help fund a healthcare system in an ongoing way, and to see a stronger healthcare system in Kono, not least because showing the world that you can build a stronger healthcare system in Kono, where lots of people have lots of excuses and lots of reasons why it doesn't make sense or why it's not possible or why it's too expensive or whatever. If we can make the case in Kono, then we can also make the case that we shouldn't accept weak healthcare systems anywhere in the world, and that we don't have to. And so I am so grateful to my brother, Hank, for all of his support, and for the Awesome Socks Club, especially. The Awesome Socks Club, PIH's leading supporter in 2021. But also to everybody who has donated, the people who donate $5 a month, that means so much to this project, because it's a statement that you're providing ongoing, open-ended monthly support. And that means so much. It allows us, and it allows PIH and the Ministry of Health in Sierra Leone to plan further into the future, and to know that there's ongoing revenue coming into the system. So if you're able to join us in donating, pih.org/HankandJohn is the place to sign up. You can make a one-time gift or become a monthly donor. And if you want to donate more, if you're in a position to donate $2,000 or more, you can join our matching fund. It is thanks to the incredible generosity of dozens of matching donors within this community that every dollar that's been donated through pih.org/HankandJohn has been matched by those people. So thank you to all those people. And here's to the Maternal Center of Excellence, a stronger healthcare system in Kono, and a brighter future for women and children and everyone in Kono and beyond. Thank you so much. Isada, John, Byler, Hank, thank you all so much. Cheers. And thank you to everybody in Nerd Fights area.
Okay, thank you.
All right, it's great to see you all. DFTBA.
Bye.
Thanks, everyone.
Thank you.
Thank you.
Bye.
Thank you, everyone. Bye.